Today we're going to be talking about physical disabilities and health problems. A physical disability is a condition that affects the bones, muscles, or joints, while a health problem limits the strength, alertness, or vitality. The most common physical disability in children is the cerebral palsy. This is a condition that affects the way the body moves. And this happens either because the brain got hurt early in life or it just simply didn't develop the way it was supposed to develop. When a child has this, we might notice they walk different or need help moving. We might also notice they have stiff or floppy muscles, and they usually use walkers or wheelchairs to be able to get around. They talk or eat in a different way. Babies usually tend to take longer to sit, crawl, walk, stand. But we got to remember to be kind, to be patient, to, ask if they would like help, but always wait for a yes or no answer before moving forward. The next physical disability we're going to be talking about is muscular dystrophy. And muscular dystrophy is a condition that makes muscles weak over time. This is something the child is born with, and this is when the body doesn't make the protein necessary that the muscles need to be strong. Children who have muscular dystrophy get tired quickly while they're playing, have trouble walking or climbing, need help lifting things or doing sports. You might also notice that they will be using wheelchairs or braces to help them move. Remember, muscles are important. They help us move, they help us walk, smile, they help us breathe, along with every other movement we use in our body. So when you see someone struggling, always remember to be kind. Invite them to play, but also be patient if they're moving slower and need help. And you can also always ask questions, but always do it in a respectful manner. Our next physical disability is hip dysplasia. And this is when the hip doesn't fit properly into the thigh bone or the socket of the thigh. Children are usually born with it, but it does sometimes show up over time. And this can happen on one hip or both hips. Again, we might notice the child is walking different. They might have pain in their hip or legs, or one leg might look shorter than the other. And of course, they'll need help with walking or running. For babies, usually using a soft brace can help the hip grow into place. Sometimes surgery may be needed to fix the joint, and physical therapy is always recommended. Remember always to be kind to them, always to be patient, and always to include them in your games. Now we're going to be moving on to health problems. Epilepsy is a sudden burst of electrical activity which causes seizures. There is different type of seizures, one of them being the shaking and jerking of arms and legs. Another type of seizure is staring off and not responding for a few seconds, or falling down and feeling confused. This usually doesn't last long, but people do feel extremely tired after they've had a seizure. With epilepsy, people might be born with it, or they might develop it after an injury or an illness. Medicine can usually help stop or reduce seizures, but always remember, if someone is having a seizure, to try to stay calm and get help from an adult. Be kind, don't tease them, don't stare at them. Always be respectful. Now, asthma. Asthma is a condition that affects the lungs and it makes it difficult to breathe. When someone is typically getting an asthma attack, they're coughing a lot or wheezing, which is like whistling every time they breathe. They feel their chest tighten and have a lot of trouble catching their breath. Usually medicine will make an asthma attack better, right away. If someone has asthma, you need to avoid triggers like dust, pollen, smoke, or running too fast, and stay calm and get help. Not tease our friends, not tease children, not tease adults who have an inhaler and need it. Always be kind. Always include them, even if it may be a slower pace. Include them or if they take longer, include them in every activity. Our last health problem we're going to be talking about is diabetes. Now, diabetes is a condition where the body has trouble using sugar the right way. Sugar in this case is called glucose. So the body typically uses a hormone called insulin, and what insulin does, it helps move the sugar from the blood into the cells. Usually when a person has diabetes is because their body is not making the insulin, or the insulin is not working properly to push the sugar from the blood into the cell. There's two types of diabetes, diabetes 1 and diabetes 2. So diabetes 1 is when the body does not make any insulin at all. And usually you will need a shot or a pump. And diabetes 2 is when the body is making insulin, but it is not being used well. This is more common to adults, but some kids have gotten it as well. What helps with this is eating healthy, getting exercise, checking blood sugar levels, and using insulin or medicine if needed. Again, remember to be kind, not to tease someone for checking their blood sugar or using their medicine. Be patient if they need a snack or a break. Learn what to do if they feel dizzy or shaky, because that is a sign of their blood sugar dropping, maybe too low. And be respectful.